As we know, private insurance is difficult to deal with, and many Americans either don't have private insurance or they're dealing with a private insurer that refuses to authorize treatments that they need. So capitalism works in funny ways. Now we have Groupon offering discounts and coupons for various medical procedures. This was reported recently in the Kaiser Family Foundation publishes some news articles. They published something on this as well. And so I want to show you a quick screenshot. It kind of gives you an idea of what some of these Groupons look like. And in this case, it's for an X-ray. And the journalist, Kaiser Health News reported this. Lauren Weber wrote this piece, and she writes, Crown Valley Imaging in Mission Viejo, California has been selling Groupon deals for services including heart scans and full body CT scans since February of 2017, despite what Crown Valley's president, Sammy Bedone, called out the aggressive financial practices. According to him, Groupon dictates the price for its deals based on the competition in the area and then takes a substantial cut. So, okay, I mean, I don't really have anything to say about Groupon's business practices, but I do have a lot to say about the fact that people are relying on coupons in order to get some of the screenings that they need. By the way, I just want to note, for all the people on the right who want to defund Planned Parenthood, when I was younger and did not have health insurance, I went to Planned Parenthood when I found a lump in my breast, and they saw me for free. And there are people who rely on Planned Parenthood for way more than reproductive health. So just something to keep in mind.
Men and women as well. Yes. Men are welcome at Planned Parenthood, and you can go get an STD screening no matter who you are at Planned Parenthood.
Yeah. Brittany Swanson, who works in the front office at Outpatient Imaging in the Buckhead neighborhood of Atlanta, said she has seen hundreds of customers come through the center with Groupons for mammograms, body scans, and other screenings. And this is something that's becoming more and more widespread. It's just something that people are turning to because that's what healthcare is in America.
Yeah. We need Medicare for all. That's the bottom line.
We
need universal. I just performed in Canada this past weekend, and Canadians are better laughers. You know why? Because they're not worried about what happens to them if they get hit by a truck.
That is right.
Because they have health care.
How much freer you live when you can actually take care of your health and body and your loved ones and just live your life and not have to worry about getting sick or getting hurt. And and it's years ago, I remember seeing Groupons for plastic surgery and all these other procedures, and I kind of laughed it off thinking, oh, do you really want to spend that money? You might end up, with an implant on the side of your head or something weird like that. And now seeing this, the fact that people are getting mammograms using Groupons, they're getting actual health procedures that are necessary. It just speaks to how broken our system is. And I think it's great that people can access this, but it should not be this way.
And it's not just about the discount that you get through the coupons. I mean, obviously there's a marketing aspect to this. Maybe someone has a private practice and wants to get some more patients through the door. But there's also one other point that I wanted to make about how these procedures and these screenings are priced. There is no set price, right? So you can go to one doctor's office and a mammogram can cost you, I don't know, I'm just gonna throw a number out there, $500. Then you'll go to a different doctor's office and they charge $2,000. You have no idea, and there's no transparency up front. I mean, I remember getting so many surprise bills when I had a health scare, and I thought, all right, I paid my deductible, right? My high deductible was paid out of pocket. There's no way I'm gonna have to pay more. And then a month later, I get a bill for $419 from the lab, right?
Yes.
So these are the types of non-transparent, opaque issues that we deal with when we go see a doctor. So when you have a Groupon that tells you, all right, you're gonna get a mammogram for $99, there's like a little bit of peace of mind knowing I'm just gonna pay that $99 and then I don't have to deal with the rest.
By the way, whenever I use a Groupon at a restaurant, I always get side eye from the waiter.
Me too.
And so what's gonna happen if I use a Groupon for like an actual health scare? Is the doctor gonna be like, oh, you're a cheap bastard. You just, I'm gonna phone in this procedure on you.
It is weird that happens because the restaurant and in this case the doctor's offices make these deals with Groupon.
Yeah. But they don't like it.
So it's like, what do you expect? And something that a lot of people may not know, but you kind of have the option to it. Some of these providers will actually negotiate with you if you can pay cash. So
and not go through insurance.
Yeah, and so that's That's something you might want to discuss too. That's an option because insurance providers, it's a lot of paperwork on their behalf and they have to wait months and months. So if you can pay right then and there, there's some negotiation there. So there are options, but again, it should not be this way.
Definitely. And also, don't be afraid to ask your doctor how much things cost before they actually start running tests and labs. You know, if they're being wishy-washy on it, then that's a huge red flag. But I've just kind of learned to just right up front say, hey, I need to know how much this costs before you do it.
Yep.
Because you don't want to be hit with all these surprise bills. It's just, I don't know, it's devastating. This is what we're dealing with in one of the richest countries in the world.
The TYT Plus app is now available on iOS and Android. Download to get more TYT content at tyt.com/app.